losing hair. Whether you are a student, whether you're studying for your exams, whether you're a working professional, or whether you've reached your 50s to 60s, due to several reasons, or due to many reasons, people tend to lose hair. If you look at females, females usually lose hair due to stress, due to lack of nutrition or insufficient nutrition. For example, even though we eat a big plate of rice, or we eat lots of carbs, or a piece of chicken or egg, it doesn't really mean that we get all the nutrients we need for our hair, because hair specifically needs micronutrients like biotin, like selenium, zinc, micronutrients and vitamins, so which even our malum is tempered, so which means we really don't get a good supply of nutrients for our hair. Apart from that, we do lots of, as females, we do lots of chemical treatments like perming, straightening, coloring, and especially when we have graying, once a month the gray coverage, or once a month people use colors, and it really damages the hair because they are chemicals. Apart from the nutritional issues and the chemical treatments, continuous usage of hot water, and also certain medical issues like thyroid imbalances, which most people do have. Vitamin D deficiency is one issue which is usually overlooked, because most people don't know that they have vitamin D deficiency. But if you feel bone aches and pains, body aches, and also severe hair loss, usually we'll check for thyroid issues, vitamin D. And also on the other hand, if you have hormonal imbalances where you don't get your regular period, you have polycystic ovarian syndrome, hair loss can also be a symptom of that. Looking at men, the main reasons why boys or men lose hair is predominantly because of their male hormone testosterone. Nature has made you in such a way that having testosterone is great, but when testosterone converts into a hormone called DHT, or dihydrotestosterone, this attacks the hair follicles, especially in the front and the mid regions of your scalp, which is why this particular type of hair loss is known as male pattern baldness or male pattern hair loss. So obviously as men we can't reduce your testosterone levels, hence why hair loss is an inevitable issue, which we do certain treatments and certain things to control as much as possible, so you won't reach premature balding. On the other hand, stress, like for everyone else, high levels of stress, when you have dandruff and scalp disorders, or dry scalp or itchy scalp, when you continuously use hats, caps or helmets, because the friction will lose hair. Also, if you've been using hair gels or wax or hairspray continuously in your younger days, because the chemicals, you can also have a hair loss. One main reason that we can't prevent is the hereditary factor or the family history. If your mom or your dad or anyone in your immediate family have premature hair loss or premature balding or thinning of hair, you also inevitably inherit those genes. So you have to do everything possible to make the hair grow much faster and nourish the hair. Additional factors include, now I discussed about certain issues like thyroid and vitamin D deficiency, but also when you take certain medications like antidepressants or certain other medications, you also would notice that you'd see a increased amount of hair shedding or hair loss. Now we discussed about a few reasons of why you would lose hair. But having said that, you and I, we both know that everyone or every other person we know are taking some sort of hair vitamins, they are using hair oils, people are getting hair conditioning and protein treatments done. You do a little bit of care, love and care for your hair. But still, we do notice that you lose a lot of hair and your hair is thinning. So that means just having a vitamin alone or just applying a hair oil sometimes may not be enough. If you are already working in a high-stressed environment, or if you have certain illnesses or sicknesses, or if you have a family history, and if you want a nice head full of hair, you would need to do something more than just taking a vitamin or applying a serum or oil. So let me take you through the options that you have. Number 1, the average amount of hair loss in any human is about 50 to 100 hair per day. just like how a healthy tree would shed leaves every day, just like how cats and dogs or animals would shed fur, we also shed. If you have a growth, you have to lose it. So obviously 50 to 100 hair a day is a normal amount of hair loss or hair shedding. But if you are losing more than that, if you are seeing bald spots through your hair in the scalp, if you are noticing that the density of your hair is less, then you definitely need to do something more. So number one, of course, you can ask a doctor, because don't self-prescribe vitamins, because especially vitamin A, D, E, K and certain other vitamins in excess amounts are not good for the body. So even though you think and you take it long term, it might be harmful. So always ask a doctor and start your vitamins. So number one, you can take vitamins. You can apply a good hair oil. You can apply a nice anti-hair loss serum. There are multiple amounts of products in the market, so you can ask and use them. Number two, if you are losing more and if the vitamins aren't helping you, then the next option that you can consider is platelet-rich plasma, which is an amazing and absolutely natural treatment that we do. That's done all over the world. Actually, not only in cosmetic medicine. Platelet-rich plasma is used in orthopedic surgery for joint pains. It's used by many star athletic sportsmen and women for their health-related issues. We use it in plastic surgery to revive burn scars and burn skin. Then we use platelet-rich plasma for hair regrowth, for skin rejuvenation. It was widely made popular by Kim Kardashian and a couple of other celebrities as the vampire facial. So platelet-rich plasma is basically, we take a small sample of your own blood, and each person has certain amount of growth factors which has the amazing ability to repair your tissues just by using your own blood. And we don't add anything. We can add, but even on its own, it has an amazing ability to repair and regenerate your tissues. So what we do is within a 1.5 to 2 hour process or time duration, we take a small sample, like 10 ml of your own blood, and while you relax with a numbing cream on your scalp, we numb your scalp a bit, and we would process it and take just the protein portion, and we would deliver it to your scalp. Of course, you feel a small mosquito, like a small mosquito bite, but it's not excruciatingly painful, or you can immediately get back to your normal activities after the procedure. So according to scientific research, you can go on Google and you can type platelet-rich plasma for hair growth. There's a number of scientific research papers that is available that proves the effectiveness of this treatment. So read up, don't take my word for it, just read up on it, and it's absolutely safe, because there is no possibility for you to get an allergic reaction to something which we have taken out of your own blood. So hence why it's absolutely safe. So according to the research, you can do 1 treatment per month, up to 3 sessions if you have an average amount of loss. But if you are already bald, or if you have severe deficiency of hair, then you might need to do a bit more than that, 1 per month. And every 6 months you can maintain by doing 1 session. Obviously, how it works is, imagine if you have a plant and you put fertilizer to that plant. Compared to another plant, the plant which we give fertilizer will grow much faster. So it's the same phenomenon that we use in PRP, and it's absolutely safe and it's non-surgical. Moving on, option 3. So if you have an area which is completely bald and there is no hope, depending on your doctor's advice, there is no hope with PRP, then your step 3 would to go for a hair transplant surgery. What we do in hair transplant is basically, this is for people who actually have hair behind and they don't have hair in the front most of the time. So what we do is we would take, there are 2 techniques. There's one called follicular unit extraction, FUE and FUT. So you take a small hair strand, a hair follicle, and you plant it on the area where you don't have. So this usually involves a 6 to 8 hour surgical procedure where it's done by a surgeon who is specialized in it, and there is a significant amount of downtime involved with it. And the success rate, now the success rate of PRP, if you are the right candidate, is usually about 75 to 85%, which is a very good success rate. The success rate of hair transplant usually, someone would say, is 50-50, because it could go really, really well for certain people, and according to experience, due to certain reasons, you could lose all the hair that you got transplanted. So ideally, when we even consider transplant, we would make your hair follicles healthy by doing a PRP first, even if you are a candidate for suitable for hair transplant. Now, if you've lost a lot of your hair, a significant amount of hair, where you can't go for a PRP, where you can't go for a transplant, literally you are completely bald. So hair is absolutely an accessory. Especially for men, when you don't have hair, when you're bald, some men look great. But for most people, it makes you look old, which is why everyone is so concerned when you lose hair. And for women, for certain people, not for all, because some people are actually not bothered about it and it doesn't affect them, which is great. But for certain people, when you lose hair, it affects them significantly. So let's say now you can't do PRP, you can't do transplant, you're not a good candidate. So what is your third option? For a female, now because when you have very few hair and you want volume, even when we do the PRP, it will take 6 to 8 months of time for you to see a nice improvement. So until then, you can consider the clip-ons, or you can consider hair extensions, which can be done. We have a couple of good places in Sri Lanka where they do it. You can consider hair extensions. But the thing is, hair extensions are temporary. Again, if you have very few hair, and onto the hair, when you plug in another extension, it could damage the existing hair. So if you, just as a temporary measure, you can use extensions. Then you can use wigs, suitable for you, especially when, for those of you who are undergoing chemotherapy. We can do PRP, we can do so many other treatments to improve or revive your hair growth after chemo. But until that, for your self-confidence, you can use hair wigs. Now, for those of you, now this of course is especially for men. If you don't have much hair, or if at all you don't have hair at all, but you don't like to see yourself with hair, there is a system where it's actually called hair systems, where you design, the technician would design a hairstyle suitable for you, and you would paste it on your scalp, which you can take showers, you can do your daily activities. It's called the hair system, and you just have to do a monthly touch-up to maintain that. So we spoke about hair systems, hair wigs, extensions. Basically, these are the things that's available. There's also another method called hair implant, where you implant each and every strand, but that has a 2 to 5 year period, and it is costly. So it all depends on your budget, on the practicality. So my opinion is, if you are experiencing a significant hair loss, we have to try as much as possible to regrow your natural hair, because going in for artificial methods or for other options, they should be the last resort, because if you go into those, you're not really focusing on the growth of your natural hair. So if these things fail, but if you are not a candidate, then obviously we can choose the other options that we discussed. There is another really nice treatment which is called as the hair growth cold light therapy. It is not a form of laser. Laser is absolutely safe, but this particular treatment is not a laser. It's a form of light therapy where you sit under the light for about 20 minutes, and this is for people who are noticing a moderate amount of hair loss, or you can use it with PRP, in combination with PRP, to get optimum results. So the cold light therapy for the hair growth, it can be done 2 to 3 times a week. It can be done continuously. What happens is, now if this is the hair follicle, and each hair follicle has a blood circulation stimulating the root. So whatever we drink, whatever we do, everything actually has to go through the blood circulation to strengthen the follicle, because even though we apply oil, we do certain things from externally, there's only a very few percentage that penetrates in. The vast amount of nourishment happens through the blood circulation to the follicle. So what we do with this light therapy is it stimulates the circulation and it increases the circulation to the follicle, thereby nourishing the hair follicle. So we can combine the hair growth light therapy with it. It's a great, it gives really nice results as well. So if you are experiencing excessive amount of hair loss, I hope this video helped you. If you have any questions, you can comment below. We'll try to answer them. Always remember to get expert medical opinion. Don't self-medicate yourself. And if you act early, you can actually improve your hair loss and have a great head of hair.